Hello, everyone. You're welcome to my channel. Yeah, my name is Maureen, and today I'll be talking about supporting information. I should have done this video a long time ago, but life happened. So, if you're a nurse, hoping to get a job, in the United Kingdom, like if you're applying via, say, track jobs, you will need supporting information. So I've got lots of messages and questions about how to go about supporting information. Yeah. So first thing first, for the supporting information, you need to have this in mind. The employers are looking for certain criteria, and you should know that there are lots of applicants. So why do you think they should employ you? Yeah. And I also want to do a disclaimer, please. This is not to say that, oh, everything I've said here is something you should just copy and paste in your supporting information, but it's a guide as to what you should write. All right. So first thing first, okay, you need to introduce yourself. Who are you? Let's meet you. And then you say your name, you introduce your name, you write your name, introduce yourself, and then you are a registered, whichever country you're from. If it's Nigeria, Ghana, you're a registered Nigerian nurse, and then that you have passed your IELTS, you've passed your NMC CBT, and you've got authorization to sit for OSCE. Obviously, puts you this makes you stand out because they know that you are the right candidate they are looking out for. Do you get? So automatically you stand out. And then when you're done with that, you then proceed to say, yeah, so you proceed to say where you've worked all this while, like say you have your background, your clinical background. Say you are you've worked in a surgical unit, say medical and surgical units. Yeah, some people make the mistake of saying, oh, I've worked as a midwife, I've worked as a in orthopedic unit, I've worked. It's quite it's not really cool that way. So if you have medical or surgical, if you've worked in a medical or surgical unit, why not stick to that? I understand that we've gone for posting. Yeah, posting is cool, but aside posting, you're telling them where you have worked as a registered nurse, not as a student nurse. So if you stick to, yeah, I've worked in the medical unit or medical surgical unit, yeah, and then they give the period of time, yeah, that's cool that way. And then you tell them the number of years that you've worked, yeah, and then you tell them the clinical skills you have gained over time. Can you cannulate? Can you do venipuncture? Can you do nebulization? Can you do these skills? You get, like you mentioned the skills. Can you do wound care? You get, you tell them the skills that you can do. You tell them the skills you can take vital signs. You can do this. You tell them the skills you can do. Bearing in mind that the hallmark of nursing is safety of the patient. You know, like you're nursing a patient, that's in, consider that you want this patient to be safe, so the safety of the patient is priority. So while you're mentioning the skills, you can find a way around it, that as in, right, whilst maintaining the safety of patients. And then these are skills. And also, can you recognize acutely ill patients? Can you escalate it when the patient is deteriorating? Can you monitor ops as at when due and know that this patient is deteriorating and escalate immediately? Or is it that you don't even know when a patient is deteriorating? So these are things they look out for. And then, are you able to assess the needs of these patients, prioritize them, and meet them according to NMC standard? Because obviously, there's a standard of care that you should give. Yeah, there's a standard of care. So all these care, competence, everything, CCs, everything, compassion, you have to find a way around it. Write it like in your supporting statement. Write it that you're compassionate, you can provide care, dignity of the patient is respected, you respect your patient and privacy and all of those. And yeah, you just like providing care with a certain standard. Yeah, obviously there's a standard of care that's required. And then aside that, what else do they look out for? Your soft skills. Are you adaptable? Are you teachable? Or are you lord of yourself? Do you um like know that there are authorities, people you should report to, your junior what is that? Do you understand the importance of communication? Yeah, you get. So these are things, teamwork as well. Teamwork, soft skills, like you're a team worker, you're patient, like you know excuse me, you're adaptable, you're flexible. So these are things, your soft skills, it's very, very important. Yeah. So they're also looking out for those things as well. And then like your ability to put all this information together, and obviously things that you have done. Yeah, you get things that you have done. And like, oh, okay, in terms of competence, let's assume a patient with COVID and all that. Like, obviously you know that infection control should be involved. Yeah, you get. So are you working within your limits of competence? Like, if you're supposed to do a training, do you even know that you should do that training before you gain access to even attend to a patient, to provide that particular care for a patient? So these are the things they're looking out for. So those things you see that NMC is keen on, 6 C's, and prioritizing patients, and all those things you need to write them down whilst writing your what's it called, your supporting information. So it's very, very important. And then if you can even say like, say, let's assume now in a scenario, and then a patient is deteriorating, and a patient is medically fit, who would you attend to? You prioritize your care. So these are things that you should have at the back of your mind whilst writing your supporting information. It's just say that you're selling yourself. You're telling them skills that will be relevant to your employment, and how you intend to look after these patients, after your patients, how you intend to look after your patients. Are you someone that like knowledge, or you came in with RN, you want to remain with RN? Tell them you're someone that you like growth, like you like growth, and you intend providing safe care. By that, you always seek after knowledge, you always try to improve yourself. Relevant knowledge, evidence based practice, that is key. Once you write obviously it's a disclaimer, it's just a guide. So evidence based practice, why do you do what you do? Why do you monitor the news too of these patients? Why are you doing that? The cannula, why do you check? Why are you checking a cannula? Yeah. Oh, okay. Is there phlebitis? How long has this cannula stayed? It's evidence-based practice. So everything, research is ongoing. So you should be someone that, yeah, you're always researching, you're reading, you know the policy of the trust, and you abide to the protocols of your trust. There's protocols, there are protocols, there are things the trust has come up with over the years. And then nurses are or the multidisciplinary team are working with it. So are you somebody that, yeah, you want to find out what's the trust policy regarding these guidelines? And then are you even able to even work with the multidisciplinary team? Do you know when OT, occupational therapists are involved, physiotherapists, and all that? So these are things that you should really look out for, and sit down and really write in your supporting information, so that you sell yourself, and they know, yes, obviously there are things that you have done. It's not like you're just cooking them up in your head. There are things that you have done, and then you say, oh, these are the things that you have done. Remember, like we said, introduction, your skills, like your where you've worked, how long you've worked, and then your skills, your clinical skills, your soft skills, and yeah, your ability to daily, like, always improving yourself. Yeah. And I hope this helps in this little way. Please put a comment in the comment section and tell me what you think about this video, and hope to bring the best each time I come to you again. Thank you.